from HHSA. Chairman Greg Cox will lead today's press conference. Again, please limit your questions to one per person and one per follow-up. Thank you.
Welcome everyone to today's press briefing. Today we're going to be hearing from our Public Health Officer, Dr. Wilma Wooten. She will be followed by Supervisor Nathan Fletcher, who is the co-chair of the board subcommittee, followed by Dr. Luke Bergman, who is the director of our behavioral health services. Before we continue, I want to point out a valuable resource that is available for everyone in this county. We've been urging you to call your medical provider if you have symptoms and want to get screened. But we realize, unfortunately, not everyone has health insurance or a medical provider to turn to. So for those individuals, we want to encourage you to call 211 San Diego. The county has established a nurse telephone triage line to help callers who have symptoms of coronavirus and to determine the best course of action for their situation. The line is available 7 days a week from 8 a.m. to 8 p.m. A voicemail is available for callers to leave a message after hours, and a nurse will return messages within 24 hours. When you dial 211, you'll be asked to select a language and then select 1 for COVID-19 health information. You'll be prompted to select if you have symptoms and then routed to the public health nurse line. Now, we have 65 nurses that are standing by answering 60 phone lines. Again, we want you to contact your health provider first, but if you can't do that, the public health nurse line is available to all. All you have to do is to dial 3 easy numbers, 211. With that, we're going to go straight to our speakers, and I'll call up Dr. Wooten for a medical update.
Good afternoon, everyone, and thank you, Supervisor Cox. Globally, the novel coronavirus has resulted in almost 330,000 positive COVID-19 cases and 14,380 deaths. Nationwide, there are 32,644 positive cases and 404 deaths. In California, there have been, as of close of business yesterday, almost 1,500 positive cases and 29 deaths. In San Diego, 205 positive cases, which is 46 more than the number reported yesterday, as well as the 1 death that we gave you a heads up about. This total includes 71 or 35% female, 133% or 65% males, and 158 or 77% are between the ages of 20 and 59 years of age. There are 2 preteens. 1 is a San Diego County resident and 1 is not. These data will be updated at the end of the day today between 5 and 7 p.m. And going as of tomorrow, we will no longer include any additional numbers for the federal quarantine individuals because they are leaving. Also posted on the website is a link for cases by city municipality. Initially, we were going to be sending this to the city managers on a weekly basis, but it is now being reported since last Friday every day. So it is a link just under the table. When you go to the graphic on the website that has the city map with the pin in it, when you click on that, you'll see a table of the cases, and below that table is a link for these cases by city municipalities. Also, we've received questions about gatherings at our local beaches. Before, we wanted people to have the opportunity to enjoy walking on the beach while experiencing or maintaining social distancing. It looks like people are not able to do that, and we will be issuing an amendment to our health officer's order that if jurisdictions are not able to enforce social gathering, we will close beaches, and that amendment to our health officer's order will be issued later today. And we also know that many jurisdictions are closing, local jurisdictions are closing their beaches, and that's great to help enforce our social distancing order. In previous briefings, we have discussed the fact that 80% of individuals who get COVID-19 have mild to moderate symptoms. These individuals can self-isolate at home. They do not need to be tested for COVID-19. If one's condition, however, worsens, these individuals should call their doctor so that they can be evaluated. This action, staying at home if you have mild to moderate symptoms, helps to protect our healthcare workers and decreases their use of personal protective equipment. On the other side of the coin, there is great interest in the variety of methods available for individuals who need to be tested to receive that testing. One of these methods is the drive-through testing that the County of San Diego is offering at the San Diego County Credit Union Stadium. This is being offered as a testing option by doctor or physician referral only. Due to the wide-scale shortage of laboratory supplies and reagents, we are following national criteria to prioritize COVID-19 testing among 3 specific groups: healthcare workers and first responders with COVID-19 symptoms, all individuals who have symptoms for COVID-19, especially those living in congregate settings, individuals who are older adults who may have underlying medical conditions or compromised immune systems, who would have complications if they were infected by COVID-19, and therefore physicians' judgment is especially important for these populations. Another question the county has recently received is, how can we ensure safety in the food industry? Well, we ensure safety as we have always done. Restaurants and food handlers' safety training is something that we do on a regular basis, and this is done through the Department of Environmental Health at the County of San Diego. For COVID-19, one of the things that we have shared, which has been translated into 5 languages, is a document that discusses food handler illness, sanitizing procedures, and other health-related information. We can send that, we can find that document on the Department of Environmental Health's website. Additionally, the local chapters of California Restaurant Association and the Food and Beverage Association have been disseminating information to their membership, and they were included in a letter that specifically was written for them over 10 days ago. In the food handling industry and other essential services, the workforce, I want to emphasize that any worker should not go to work if they are sick. You heard me say it before, and you will likely hear me say it again. Please remember that it is safer to stay at home. Please stay at home if you do not need to go out for essential reasons, such as grocery shopping, walking your dog, or if you are considered an essential worker under the guidelines Governor Newsom set out last week. So now please welcome Supervisor Fletcher. Thank you so much for your time.
Thank you, Dr. Wooten. And again, we appreciate the public's help and cooperation. There are a number of steps we are taking to try and protect the public health of the entirety of our county. That includes our orders, our directives, our guidance. To reiterate the point that's made today is local jurisdictions who cannot and do not have confidence in their ability to enforce social distancing at their parks and beaches. If that is the case in your jurisdiction, you shall close your parks and beaches. But it is a decision to be made by each jurisdiction based on their level of confidence and their ability to ensure social distancing at their parks or their beaches. For the County of San Diego, many of our parks and recreation areas remain open because we've been able to have the cooperation of the public in enforcing social distancing. And if that changes in the future, then our posture will change as well. For a listing of parks that are open and available, please visit the County of San Diego's Parks website. Again, we are encouraging folks to get outside and exercise and enjoy the outdoors, but you have to maintain social distancing. If you are a family unit who lives together in your home, You can go out and exercise together and play together, but what we don't want is the mass congregating of multiple different units who are not ensuring that 6-foot social distancing. And it really is important as we all come together to take actions to flatten the curve, to slow the transmission, and ensure the integrity of our healthcare system. In addition to the efforts we're taking broad-based, we are aware that a number of populations and communities are particularly vulnerable. This includes areas that have been historically underserved, and we are moving rapidly to ensure equity and proper distribution of resources to help alleviate safety net gaps and availability of services in these communities. Today I want to provide an update on one of them we've been working very hard on. This morning I stood with Mayor Faulkner, Senate President Pro Tem Tony Atkins, Councilmember Chris Ward, and others to announce the opening, the city's opening of Golden Hall to serve as a homeless shelter with the proper social distancing requirements, along with to announce that we are moving forward with opening the convention center to also help house homeless individuals. Our approach to homeless is a coordinated one across jurisdictions, across entities, across agencies that is designed to ensure that we are taking every appropriate step possible to protect this population in these communities. And it's guided by a couple kind of core aims. First, we want anyone who is homeless who has symptoms to immediately get to a place of isolation and a place of care. We don't want a contagious illness to be further spread in a congregate care setting or in a setting where lots of individuals are crowded together. That's why we have secured a substantial number of public health motel rooms. These are for individuals who have tested positive or a person under investigation who do not have the ability to isolate at home. This includes our homeless population. And we're taking a number of steps to identify these individuals and to transport them into that. The second thing that we're trying to do is reduce the close proximity in the existing shelters. The simple reality is our existing homeless shelters are not set up in a way to ensure that 6 feet social distancing requirement. And so by opening Golden Hall and by opening the convention center, we can begin to reallocate and move those folks into more appropriate settings where they can still have access to food, sanitation, hygiene, public health screenings, safety, and shelter, but they can do so in a way that ensures the social distancing requirements. And we're very grateful for the City of San Diego and the Convention Center's help in providing these extra capacity. It's important to note that the Convention Center operations will be there to serve everyone countywide. It is not just a operation that is designed for those in the City of San Diego. It will be available to everyone. Third, we know that our hospitals, as we try to raise that dotted line and flattening the curve and increase the capacity of our healthcare systems, we know that our hospitals have a large number of individuals who are homeless, and our hospitals have been reluctant to discharge those individuals back onto the streets. By increasing the capacity in our sheltering system, we are having the ability to begin to move some of those folks out of a hospital setting into a sheltered situation where they have access to care. And this action will help free up very vitally needed hospital space. And then fourth, we want to make sure we have a rigorous process for screening everyone who enters into the system. County nurses are on site at 9 different shelters. As we expand operations into Golden Hall and the Convention Center, they will be on site there as well. And what we really envision is that our homeless shelters become a intake place where an unsheltered individual can go. They can get a health screening. If they have symptoms or a fever, they can immediately be sent to a public health motel room. If they are an elderly senior or they have underlying respiratory issues, they can immediately be sent to a regional task force on homeless isolation motel room. If they are neither of those two, then they can go into the shelter, get an assessment, a screening, and then be transported to the most appropriate sheltering location, again with social distancing. In addition to these steps, we have hundreds of hand washing stations out. I was out this morning checking on a few, and they're being refilled and resupplied and replenished. As we get additional requests, we will fulfill those requests. And again, our public health nurses are with homeless outreach teams throughout San Diego County. In that capacity, they are providing information, advice, hygiene kits, connection to services, as well as screening for symptoms that may be available. If you are homeless and you have symptoms, you should first contact your medical provider if you have one, like a community clinic. If you do not have a place where you have gone or you go for medical care, you can reach out to any homeless service provider who can, again, get you connected into an assessment and a screening. And if you're not connected to either of those service providers, you can call 211, where the nurse hotline can begin to triage you and potentially connect you to a location for care. But let us be clear that at San Diego County, we care about all of our residents, and we are taking action to protect all of them, including these populations. Next point, something we talked about yesterday and we've talked about a number of times before, is the vital importance that as everyone deals with not only the potential impacts of coronavirus, but the impacts of the measures associated with stopping the spread of coronavirus. Economic uncertainty, isolation, anxiety. We are very concerned, and we want the public's mental health to be seen through the same lens that we are viewing your physical health. And in this effort at the county, we are stepping up a number of tools and resources to make sure that we can provide those vital mental health services and options so that our community can remain strong and resilient. And so here today we have with us our Director of County Behavioral Health Services, Dr. Luke Bergman, to share a few tips, advice, and suggestions on things that everyone can do to really remain strong and resilient and healthy through what is a very difficult time. Dr. Bergman?
Thank you, Supervisor Fletcher. As Supervisor Fletcher was just mentioning, this is a moment that is exacerbating a lot of stress and anxiety that people have in their daily lives. There's a lot of fear, a lot of uncertainty around what's happening right now with the COVID virus. We also have looming economic difficulties that we know are associated with increased rates of depression and of substance use. And so it's extremely important that as people start to experience those feelings, that they address them now. We know from studying other disasters that expedient intervention with mental health issues will stave off challenges that could last years if care and treatment is delayed. So we really want to encourage people to get the care that they need, to take seriously their emotional responses to what's going on right now. With that in mind, I want to just emphasize a few key points. One, treatment is available. For mental health, for substance use disorders, treatment is accessible and available. The system is up and running right now. I want to note for people that it's very likely that you would access care in the current context telephonically through telehealth. We have moved the entire system into that mode of contact. It is a mode of contact that works well, and it's in fact in some ways made care more accessible. If you've got a phone, you can get care for mental health, you can get care for substance use disorder. So we strongly encourage people to continue accessing care if they feel that they need it. We would also emphasize that the best course of action if you're feeling agitated or in some sort of crisis is not to go to an emergency department right now. We really need, as Supervisor Fletcher was emphasizing, those resources for addressing issues that may be associated with COVID or may be associated with other serious physical health conditions. What we would suggest that people do in those cases is call the Access and Crisis line. The number is 888-724-7240. Again, that's 888-724-7240. 24/7, 150 different languages. You will talk to an experienced, licensed counselor who can help you in the immediate moment and help you get care ongoing as you need it. We would also emphasize that there are some things that you can do to manage your stress and anxiety and your mental health in the current moment. It's important to maintain routines related to meals, exercise, as Super Fletcher was just emphasizing. Bedtime sleep is extremely important. Connect with other people. We're in a moment characterized by distance from other people. Reach out using technology. It's extremely important. It's effective for managing anxiety and stress. Also, news is important. Information is important. Take a break. if you feel like you need it. If you're feeling overwhelmed with all the news, stop watching it for a while. And then don't be afraid to share your concerns and any issues that you may have with friends and family. It's really important to maintain those social networks. For more information on mental health and coping with COVID-19, you can go to our County Behavioral Health Services website, which we'll be making available in future communications. Thank you so much.
Thank you, Dr. Luke. We're going to go directly to the questions. Again, as we've done the last 2 days, we're going to ask you to state your name and your outlet, and we'll go ahead and take that first question right now.
Hi, Union Tribune. Please state your name and your question.
Hi, this is Charles Sisson with the Union Tribune. I wonder if we could get an update on testing. I believe you all said that testing should ramp up over the weekend significantly. We've also seen this reagent shortage. I wonder if the local folks have found a way to address that shortage. Is testing really starting to ramp up?
Okay, the question is testing starting to ramp up? Dr. Wooten?
If I understood the question correctly, is testing starting to wrap up? We are far from wrapping up, actually. Ramping up. Thank you. There are many commercial laboratories that are coming on board, as well as hospital systems. So as I stated yesterday and the day before, we will be increasing the amount of testing throughout the county, and we will see more individuals that are tested and more positive cases will be reported. So we will continue to see the increase in the number of individuals testing. Local hospitals are doing drive-through. The county, as you were told earlier, is doing drive-through. So testing will continue to increase over the coming weeks and months.
Follow-up.
Thank you, Dr. Wooten. Next question.
We have KPBS. Please state your name and your question.
My name is Matt Hoffman, calling from KPBS. Yesterday, you said that gun stores are not considered essential businesses per the governor's order and should close. We do know that some are still open in the county. What does the county do for businesses like this?
Supervisor Fletcher.
Thank you. The governor's executive order has outlined essential and non-essential businesses. Anyone that is not on the essential businesses list has been advised to close. And we're asking for the public's cooperation and help in this endeavor. We shouldn't have to take first responders who we count on to do their regular job in order to enforce these orders. And so it is our hope that the public will do it. But they are orders that have the full force of law, and we expect full compliance with any business who is not exempted under the essential business categories of the governor's executive order. And we also encourage people to continue to monitor that order for further guidance and clarification.
And so there's been no enforcement right now. It's just hoping that they comply, hoping that businesses follow these warnings, heed these efforts.
Well, if gun shops are not in compliance, we would like to know about it, and we will have the appropriate law enforcement agency make contact. Next question.
We have Valley Roadrunner newspaper. Please state your name and your question.
My name is David Ross with the Valley Roadrunner newspaper. My question is, how is the coronavirus crisis affecting law enforcement? During the crisis, what protocols are officers employing when they arrest people? Are they testing them for coronavirus before taking them to the Vista jail? Are arraignments possible? What happens to their arresting officer if the person they arrest tests positive?
We know the sheriff and local law enforcement have all taken a number of actions within each of their agencies and jurisdictions, and it'd probably be most appropriate to direct your question to them. We are ensuring that first responders, along with public health workers, are at the front of the line in order for testing when they meet the proper protocols so that they can be cleared and put back to work. They have a huge burden and a huge job in these difficult periods. It is at their discretion how they enforce the essential versus non-essential businesses, but they also are all taking a series of steps to protect their personnel, and we would encourage you to contact each jurisdiction for the actions that their individual department is taking.
Thank you.
Okay, next question.
NBC 7, please state your name and your question.
Hi, my name is Claudette Stefanian. I'm with NBC 7. The question I wanted to ask, obviously a lot of orders have been put in place, huge orders that are impacting a lot of people's lives. At the end of the day, how is the county evaluating if these measures are effective, and what tools will you be using to figure out when to scale back on some of these measures?
So there have been many measures that have been put in place for the explicit purpose of social distancing. Just as we've received reports yesterday and today about people being at the beaches and not honoring the social distancing recommendations, then that will force or require us to rethink the orders and issue additional orders to ensure social distancing. But what is evidence-based is that social distancing, whether it's school closures, working remotely from home, not going out in large numbers, we've implemented all of those strategies, and the intention is to decrease the transmission of COVID-19. And these are the types of interventions that are issued for any pandemic situation. The goal, and the explicit goal, is to separate those individuals that are infected from those individuals that are not infected, so we do not have more people that develop the infection. So when we start to see our numbers come down, that's when we will reevaluate. But right now, our numbers are continuing to increase. And as stated earlier, that's because we know that we have community-wide transmission. We are ramping up with increased testing, so we expect to see more people that test positive. But once we get to a baseline for testing, then over time, as this disease takes its course, we hope that the numbers will come down. Now, as I often say, hope is not a strategy. All of these strategies are being done to flatten the curve so that we have ample time for researchers to develop a vaccine that can be used against this particular disease.
And Dr. Wooten, since I still have you at the podium, could you clarify, I know you were mentioning that the federal quarantine number was going to be removed from the website, the number. Can you explain why?
Well, the federal quarantine, they end up being on federal quarantine in just a few days. So we are removing that information.
Thank you.
Okay, that completes the phone-in calls. We do have, I believe, 3 questions that have been submitted to us in writing.
Yes, Supervisor Cox. Rachel Bianco from 10 News asks, are you able to release more information about positive cases? For example, people who have recently flown back from Hawaii are worried they may have been on the same flight as the man who tested positive and died.
Airports or illnesses on airplanes are under the jurisdiction of the Centers for Disease Control and Prevention. And if you had contact with that individual, you should have received a letter from the CDC. So if you have not received a letter, most likely you are not at risk or not affected.
And Rachel also asks, regarding the number of cases, is it possible to say where in San Diego those cases are?
Well, a few minutes ago, we reported that the cases are on our website by municipality, by city. For confidentiality reasons, we can't drill down to sub-regional areas or give more information about the individuals, but we do have a table. It's in a link under the table for cases that provides information by city municipalities. So that information is already available to the public.
Okay, I believe we have one final question.
Actually, we have a couple of more.
Okay, a couple more.
Gina Yarbrough from San Diego County News. There's been a big concern of large gatherings at beaches and parks. What safety measures are you taking with grocery stores to prevent the spread of COVID-19 from possible infected shoppers?
Okay, Dr. Wood.
Yes, I have seen many of our grocery stores going above and beyond by not letting a large number of individuals into the grocery store so that they can maintain that social distancing. Shopping for groceries is an essential service. People have to eat. And I am very proud of our grocery stores that are implementing these self-imposed additional steps to make sure that the public adheres to social distancing when they go out to shop.
Okay, next question.
Yes, this is from Claudia Bucchio with Univision. With the growing number of cases of COVID-19, how is the county managing to trace contact history of those who have been diagnosed? And also, is retired personnel coming on board to help with that?
Dr. Wooten.
So case investigation and contact investigation is the hallmark basis for epidemiology and surveillance. And we do that in this particular case, we do that in a very robust manner. So we are continuing to do what we normally do, and we have even enhanced those measures, have more people on staff, and we're utilizing all of the tools available to us, whether it is bringing back retired staff as retired retirees, or utilizing temporary staff, or utilizing volunteers through our Medical Reserve Corps.
This has been addressed, but we'll ask again from Marilee Moore from Fox 5. We saw issues with beaches in San Diego across Southern California over the weekend. What is the plan moving forward, and will San Diego also consider shutting down hiking trails like LA?
So I think we've already addressed that question, but to share the information again, we are amending our order that if local cities and municipalities cannot enforce the social gathering order, we are amending our orders to say that they can close city parks or beaches. In the county of San Diego, as you heard Supervisor Fletcher say, we have not closed our parks because we do want individuals to enjoy the opportunity to walk with their families, but we still advise everyone to adhere to the social distancing strategies.
David from Channel 8 asks, why isn't the stadium site offering more widespread testing with screening on site? This is being done in other states.
There is a limited supply of testing capability at this time. Our instructions to everyone for individuals with mild to moderate symptoms to stay at home. You do not need to be tested. Testing is reserved for those individuals that are at greatest risk. That includes our older adults, our individuals with underlying complications, individuals with compromised immune systems, which includes individuals with HIV or individuals that might have cancer. And also our healthcare workers are also prioritized for testing. So that is our strategy. That is a national as well as a statewide strategy. We do have the drive-through, but that is by referral from providers. Once we get more capability, we will expand the criteria for testing.
Andrew Bowen from KPBS asks, you have said that senior centers are at the highest priority for testing kits. Can you tell us how many tests have been sent to local senior centers?
Well, we don't send the tests. The senior centers don't have the capability to test. If we hear about situations where it is a healthcare worker or a patient, we will send a team of nurses out to the location. We will provide them with the swabs to collect the samples, and then that will come back to our public health laboratory for testing. To date, we do not have any patients in long-term care facilities that have tested positive. We do have some workers, but no patients. So we are very confident in the strategy that we have developed, the process we've developed to assess individual long-term care facilities to ensure the safety not only of the staff, but the patients in those facilities.
Okay, that completes our questions for today. Before we break, I want to just announce that obviously these are unusual times that we're in, and the Board of Supervisors will be meeting tomorrow, but in a different setup. Tomorrow's board meeting is going to be a virtual board meeting. It'll start at 9 a.m. It will include not only the regular board agenda items, but also the land use items, which we usually hear on Wednesday, and air pollution control district items. If you wish to follow the board meeting, or if you wish to get involved in actually submitting questions, we would ask you to go to the county's website, which is sdcounty.ca.gov, and there will be directions on how you can participate in the board meeting tomorrow. You know, there's, I guess, American folklore story that says that we're all like 6 degrees of separation. That's, I know somebody that knows somebody that knows somebody that knows somebody that knows Kevin Bacon. Well, what we're asking you to do now is not 6 degrees of separation, but 6 feet of separation. We want everyone in this county to live well. We want them to stay well, but we want you to stay home. With that, we'll conclude today's press briefing. We'll be back here tomorrow afternoon at 2:30. Thank you.